welcome Dr. Gandhi. Today is May 24th, World Schizophrenia Day. We would love to ask you a few questions about schizophrenia today, you being a psychiatrist and a homeopath. So, to start with, what is schizophrenia?
Okay, we have two types of psychiatric disorders. One is minor disorders and major disorders. Minor disorders would be anxiety, phobias, obsessive compulsive disorder, certain types of depression. So, how do you differentiate? And the major are schizophrenia and bipolar disorders. So, the difference is in the minor disorders, the person is aware that he is ill. He knows that he has anxiety. He comes to me and tells me, I'm anxious. Can you help me? Or I have obsessive compulsive disorder. Can you help me? I have certain phobias. I cannot meet people. Whereas in schizophrenia and in bipolar disorder, the person, it is a little extreme form of mental illness where the person loses awareness about his illness. He doesn't know that he is ill. And that is called as absence of reality testing. He feels he's all right. Rest of the people need treatment. So very often they don't even come to us. It is the family which comes and says he's having abnormal behavior and that we need treatment. So in schizophrenia, there is a complete personality breakdown. Person lives in his own world. He has delusions, he has hallucinations, and then he believes them to be true, and he doesn't think that there is anything wrong. He may feel that all are conspiring against him, people are plotting against him. He can hear some voices, people commenting on what he is doing, which is called as hallucinations. He starts becoming weird. His emotional balance also goes away. He can become very aggressive, or he may shut himself out of fear. And it is like he is no more in contact with the outer world. He lives his inner state completely. Okay, so this total breakdown of personality is what I would call as schizophrenia.
Okay. So, next question is how to identify its symptoms. You have already spoken, but still.
Yeah, so what is it is that very often this patient is brought. Very rarely do they have insight that there is some problem. So what you see is you see changes in his behavior, in his mood, in his perceptions. So in behavior, he might start neglecting his personal hygiene. He might start muttering to himself, talking to himself, making some weird gestures. Mood can be he can become very aggressive. He can become very depressed. And this may not be the most important. What is important is he may start having delusions, beliefs. What are delusions? False, unshakable beliefs. He starts believing certain things like, he's being persecuted. He may even start feeling of grandeur. Then he might start feeling, I'm some great person. I'm some God God itself. So he may start having certain ideas or beliefs which are contrary to what people generally believe, and they are fixed. You cannot change that. And then he may even start having auditory hallucinations. Generally, they are auditory. Some other hallucinations can also occur, but mainly auditory hallucinations where he starts hearing voices as if people are talking to him, giving him commands, or making comments on him, or trying to harass him, trouble him, something of that sort. His sleep can be affected. So what happens is a person going to work may stop going to work. He may start neglecting everything, start showing a different type of behavior with the family members. He doesn't even believe that he is not all right. So in a way, what we call as, something called insanity, or in a way, very, very crude language, I would say, a sort of madness. When you feel that something has gone wrong with him, he's behaving like a mad person. That is the type. So bipolar also is a type of insanity, but what happens is there the predominant disturbances of the mood. He's either too happy or excited or angry. It's an emotional imbalance, or he's very down. Sometimes he's underconfident, doesn't feel he can do anything in life, which is also out of touch with reality. He may start feeling, I'm so poor, I have nobody in this world, I am all alone, and then he starts, which is a delusion, and then he starts feeling very, very sad, or he is very happy. He may have phases where he is completely out of energy. There might be phases where he's excited and buying and shopping, and he also becomes unrealistic. He has nothing in his pocket, but he'll spend so much money. So there the mood is disturbed. The predominant mood disturbance is what we call bipolar. And bipolar means two poles of the illness. He can have one pole or the other pole, and we never know when and which might come up. And in schizophrenia, there is total disintegration of personality.
What treatments are prevalent currently for this?
So schizophrenia, there is good treatment. Allopaths have found out medications which can be of great help. They are called as antipsychotic medications. So what does antipsychotic the medicines do? You start getting losing your emotionally you become better. Your behavior starts changing. Your hallucinations can become better or become less. Your delusions may start. The patient can start becoming functional in his personal life, occupational life, social life. So, but always with allopathy, there is a problem is that you have to pay a price because many of these medications can affect your hormonal system. You can become very fat. You may feel excessively hungry. It may affect your sexual life. It can make you dull, sleepy. So there are many prices you have to pay, but if you see in the whole bargain, compared to what you were in your insanity and what you get is definitely good. At least you come back to normal life and you can function. But there's a lot of compromises you might have to do because of the side effects. And more drugs are coming out with lesser side effects. Nevertheless, this is the effort by the pharmaceutical company and psychiatric science, medical science. But even then, it is basically symptomatic. Some of these acute schizophrenics may naturally improve, and then over a period of 6 8 months, maybe you can even stop the medications. But these are very few. Most of them, the doctor will say now you might have to take for 2 3 months, years, and then eventually, most of them land up with lifelong medication. So it's a very big compromise because basically it helps. There is no question, no two ways about it, no two things about it. But it is like symptomatic treatment where the patient is, in a way, you also make them comfortably numb. They can function, but they are not really, the quality of life does not change, and they're dependent on external sources of those medications to keep them all right. Many of them stop, then again, when you start, maybe the medications have to increase. There's a lot of dryness of mouth, constipation. And over a period of time, even the medications can go up. It's not always that a certain amount of drugs might be enough to treat them. Besides that, then there is a little bit of occupational therapy, a little bit here and there. There are some other supportive treatments, but the primary treatment is medicines. And in case if it doesn't work, then sometimes we resort to electroconvulsive therapy or the shock treatment.
Are there any alternative treatments, and how can homeopathy be helpful?
Homeopathy definitely will help, and I would really suggest. In fact, when I started doing, so I am a psychiatrist by profession, homeopathy by choice. And initially, I would think that maybe homeopathy is helpful, but it might help in anxieties, phobias, little bit of OCD, and things like that. I myself was very pessimistic. It's a schizophrenia is like a syphilitic miasm, leprosyphilitic miasm. So even when you treat, your first feeling is of pessimism, whether we can help these patients. And my feeling was that maybe I don't know. But with time and my luck, I had some opportunity where I could really help a few patients do very well. And then I got more and more confidence, and today I treat a lot of them. So I would ask only one thing. Let's say a person, I'm not saying that which pathy is better. I'm not telling you choose homeopathy and don't go for allopathy. Allopathy definitely has a very big place. But if I ask, let's say a patient who's a schizophrenic and he is on all those medications, and somebody were to ask me, and suppose if I were to suggest that I can help you probably to stop your medications, if not reduce your medications. Maybe with my treatment, your quality of life will improve. So, would you take that chance or no? I'm sure most schizophrenic and their families would do it. Most of our psychiatrist colleagues don't know about this, but there are many whom I've helped. I've even treated patients and I've shown them cases where they've improved, but some of them say, oh, but some of them improve naturally. But they don't know one case after another. So many patients have done so well. So many patients, we are able to reduce the medications. Maybe they are on bare minimum. Sometimes even the psychiatrists, when they go back to their psychiatrists and then they tell that, see, right now I'm on this medication, they are surprised. Are you sure you're only taking this and you're all right? So what happens is, patients' life improves. Many of them improve. I'm not saying all of them. That would be too much. Even schizophrenia, by allopathic medications, all of them don't improve. But a lot of them, majority of them, we can bring down the medications to a dramatic level. And they can remain on very low supportive allopathic medications. And I think this is a very good choice. So if you ask me what are the other things that can help, I would think that homeopathy as a complementary, and even some in many cases it becomes the first line treatment in some of these, and especially acute cases where they do remarkably well. So I would recommend that people should go for this treatment. And now there are many people who are studying in homeopathy who become MD homeopaths in psychiatry. I myself, last 3 years, am mentoring students for what we call as FHPC, which is Fellowship in Homeopathy, Psychiatry and Counseling. And there are 50 students every year coming to me, after which they give some exams and they get an officially recognized degree by the University of Nasik, MUHS, and they are practicing. And I'm amazed how well they are doing. So I would rather say don't choose which is better, this or that. There are some who are definitely are the ones who will say, we don't want to go for allopathy, we want to come to you. Lucky, come, we can help them. But there are many who go to allopaths, take medications. Even them, I will tell, please go to some nice person who knows homeopathy well and who has been trained specially in psychiatry. And then if you go to them and they treat the patient, I think there'll be a remarkable change. Most of the patients, schizophrenics over a period of time, are fed up of those medications and they're just looking for some way or the other where they can reduce the medication. Sometimes they do it themselves, not sometimes, very often. And they land up in trouble because they all have relapses. Then the doctor is very angry with them and tell them this should not be done. Some of them, after some time, don't want to take medications, and they have to be slyly given medications. So many problems are there in treating because, first of all, we are treating them without their own consent because they don't feel they need treatment. So, it is not an easy thing. And if homeopathy can help, I think everybody should try. And it can be of a great help.
What is the role of family support group and rehabilitation in schizophrenia?
It is very important because it's like a very severe illness. Somebody going through, very often family go through blame game. The husband will say it's all because of you, you have spoiled him. Many of them feel that the upbringing of the child was not good. Parents can go through a lot of guilt. Then lot of blaming each other. Sometimes what happens that this child who's schizophrenic takes away all the time and other children get neglected. So I think parents who don't know what is happening, sometimes they even think that he's deliberately doing it or not. So they need a lot of support, education. Sometimes they need supportive groups. They go into the group and they talk to each other's family how they are handling, and that gives a lot of help. And this is always welcome. If it is there, it is welcome. Or individually also, I think the homeopath should find some time and talk to them and address all the difficulties. You should not say that, okay, my job is the patient and I don't know how you handle is your problem. I don't think anybody does that. But I think that the family needs to be taken into account. Broad, everybody has to be broad. Tell them that it is not because of anybody that this child, it is his inherent state that is coming up. And it has nothing to do with just the upbringing because of which the child is. It is the basic trait. The boy shows a lot of traits from childhood which suggest that he could, in his elderly life or later ages, post adolescence, he could go into schizophrenic state. And that means it is something which just was inherently there, but it came out or it became more overt and expressed outwardly in terms of schizophrenia at a certain age.
Okay, to end with something about your other song clinic. And
Other song is doing wonderful job. I was there for more than 10 years now, and very dedicated senior homeopaths are coming. Hmm? And it's a joy. And because we have very good staff, a lot of people who are also uh, assistant doctors who are there, and they are all very dedicated. Sometimes we don't help each other. Homeopathy is not very easy science. It's very difficult. And sometimes even the best of the homeopath may fail to understand or find the right remedy. So we even refer cases to each other. It's a teamwork and done with a lot of dedication. The whole idea of this whole TOS or the other song was how we can promote this science and do good to the society. And so this is a very, very, very good thing. I think it is something which you will not get anywhere in the world. With so many courses, teaching, so many students are coming out from the undergraduates when they finish their MBBS from sorry MBBS I'm saying BHMS when they finish, and when they come they are so raw, they don't know how to teach, they don't know how to practice, and many of them then they resort to trying, they may even go and do some allopathic medications. And I think we orient them, have basic courses, we have advanced courses, then we have these fellowship courses, then individual doctors have their own lectures. And I think, I feel it's a very fulfilling thing that we are there and we are doing, and more people, if they take advantage of this situation, it is very good. So many students from all over the world come to learn. It is like it is Nalanda of homeopathy. People from all over the world come, and it has become a great teaching center. And I feel very privileged that I'm a part of it.
thank you so much, sir, for sharing your
My
insights and
pleasure,
experiences.
and all the best to everyone.